Take a look at this. It's a really powerful transformation, isn't it? You'd probably think this took some kind of major surgery, but the key to this result is actually far more elegant. Just a single, precisely placed injection. Okay, let's dive right in. In this explainer, we're going to break down a complete clinician's guide to mastering the treatment of a gummy smile using botulinum toxin. We're going to focus on three main things: precision, anatomy, and of course, patient safety. So here's our game plan. First, we'll establish what a gummy smile actually is. Then we'll get into diagnosis, and this part is so important. After that, we'll cover the core anatomy, the injection technique itself, and we'll wrap it all up with the essential safety protocols. Let's get to it. All right, first things first, we've got to be on the same page. We need a solid clinical definition. What are we really treating when someone comes in talking about a gummy smile? So, in the clinic, this is called Excessive Gingival Display, or EGD for short. And here's the magic number you really need to remember. The diagnosis is confirmed when there's more than 3 millimeters of gum showing during a full dynamic smile. That 3 millimeter line, that's our standard. In this picture, it's the perfect example of that 3 millimeter rule in action. I mean, you can see it plain as day, that significant gum tissue showing right above the teeth. This is exactly what we're talking about. We're moving from just a feeling the patient has to something we can actually measure. Okay, so we know what it is. Now let's talk about what I think is probably the single most important step: diagnosis. Seriously, if you don't get this part right, the whole treatment plan can fall apart before you even begin. And this really gets to the heart of it. You've got to remember, Botox is an amazing tool, but it's a specialized tool. It's not a magic wand for every single case. It specifically goes after muscles that are overactive or hypermobile. If the problem is with the skeleton or the teeth, well, Botox isn't going to be your answer. All right, so let's look at the usual suspects. A hypermobile upper lip. That's our bullseye. That's when those lip elevator muscles are just doing way too much. But then you have other causes, right? Things like vertical maxillary excess. That's a skeletal thing. Or maybe a short upper lip. Those require totally different game plans, like orthognathic surgery or a gingivectomy. Okay, this slide right here, this is pure gold, especially if you're prepping for exams. Think of it like a diagnostic map. So, for instance, if you see the gummy smile is mostly at the front, from the incisors to the canines, your prime suspects are the LLSN and LLS muscles. See? Being able to link what you see to the anatomy underneath, that's the whole game. And that table is the perfect segue into our next section, the anatomy. We just named the muscles, so now let's get a really good look at the main players we're going after. We call them the elevator trio. And boom, here they are. This diagram lays it all out. You've got these three primary muscles that all kind of meet up near the side of the nose and then go down into the upper lip. They all pull together to lift that lip when you smile. These three are our targets. Okay, let's give these muscles their proper names. And don't let them scare you. We have the levator labialis superioris alae nasi. We just call it LLSAN for short. Then the levator labii superiors, or LLS. And finally, the zygomaticus minor, or ZYMI. LLSAN, LLS, and ZYMI. Burn those three into your memory. They're the whole reason this treatment works.
So how does this actually work? What's the science? Well, what Botox does is something called a partial chemical denervation. Basically, it gets in there and blocks the release of a neurotransmitter called acetylcholine. And if you don't have acetylcholine, the muscle can't contract. Simple as that. We get a nice, controlled relaxation of those overactive elevator muscles.
All right, we know the what and the why. Time for the how. This is all about the technique, and we're going to focus on a really elegant modern approach that's pretty much become the gold standard. It's called the Yonsei Point. So, what is the Yonsei Point? It's not just some random spot. It's a very specific anatomical landmark. It's the exact spot where our elevator trio, that LLSAN, LLS, and ZMI, all come together. It's the strategic bullseye for our injection. And a little pro tip here, for dosing, most clinicians will start with about 2 to 3 units of botulinum toxin on each side right at this point. So let's take this from the anatomy book and put it on a real person's face. As you can see, the landmark for the Yonsei Point is pretty easy to find. You just go about 1 centimeter out from the side of the nostril and then about 3 centimeters up from the corner of the mouth. That's your spot. So what makes this technique so great? Well, for one, you get all 3 muscles with a single, precise injection. This means we're getting controlled modulation, not total paralysis. And that's the key, right? The goal is just to soften that pull enough to correct the gummy smile, but still keep the natural movement of the lip. You totally avoid that awful frozen look. Managing your patient's expectations is absolutely crucial. You need to tell them they'll start to see the muscles relax in about 2 to 10 days. The full, final result, that'll be visible at the 2-week mark, and they can expect it to last anywhere from 3 to 6 months before they'll need to come back for a touch-up. All right, let's get into our final section, and honestly, this might be the most important one of all. As clinicians, our #1 job is keeping our patients safe. That means you have to know your contraindications inside and out, and you have to know how to prevent and handle any complications. So, let's kick this off with a question you have to ask yourself every single time with every single patient. Who should not get this procedure? Knowing who not to treat is absolutely non-negotiable. Okay, here's your list of absolute no-goes. We're talking about anyone who is pregnant or breastfeeding, anyone with a neuromuscular disorder like myasthenia gravis, or any kind of infection at the spot you plan to inject. And this next one is super important. Patients on aminoglycoside antibiotics. You have to watch out for those because they can actually amplify the toxin's effect and cause some serious muscle weakness. And of course, anyone with a known allergy to Botox or even the saline it's mixed with. Okay, so what are the risks? What can go wrong? Well, the most common issues you might see are liptosis, that's a droopy lip, or asymmetry, where one side is different from the other. But here's the beauty of it. Preventing these is all about your technique. Inject with precision, you avoid the droop. Use the same depth and dose on both sides, you prevent asymmetry. And know your anatomy so you stay away from that orbicularis oris muscle and you'll preserve function. And here it is, maybe the most important thing you'll tell your patient after the procedure. You have to instruct them to stay upright and not to touch or massage the area for at least 4 hours. This is so important because it stops the toxin from spreading to muscles where you don't want it, which is what causes a lot of bad side effects. 4 hours, upright, no touching, simple. So there you have it. We've gone through the science, we've looked at the anatomy, and we've broken down the technique. But real mastery, that's something more. It's about being able to connect with your patient and manage their expectations every step of the way. That's the final piece of the puzzle. That's the art that truly elevates the science.